inside. Get what we need.
And this is this week's Closet Classic.
Hello there. Excuse me for interrupting. I see that you're preparing chicken for dinner.
Well, yes, I am.
I have a suggestion for you. According to food safety procedures, you should always wash your cutting board with hot water, soap, and even bleach before using it for other foods like raw vegetables.
Really? Why is that?
There are dangerous bacteria in raw meat that you could pass along to that tomato and then pass along to you and your family. Those bacteria could cause you and your family to become sick.
Oh, okay.
We cook raw meat to kill those dangerous bacteria, but before it's cooked, raw meat should be handled carefully.
Well, I bet there are other safety procedures I should know about.
Did you say there are other safety procedures you'd like to know about?
Yes. Yes, I did.
In fact, there's lots of information available on the internet, at your library, and at your local department or board of public health.
My local department or board of public health?
Yes, here in Massachusetts, every town and city has its own local public health department or board. Food protection and foodborne illness are just two areas covered under the umbrella of public health.
I don't need public health. We already have a family doctor.
Actually, public health is very different. Doctors treat illnesses. Public health works with communities to prevent those illnesses from occurring in the first place. So everyone needs public health.
Everyone? How so?
Well, that glass of water you're drinking is a good example. Public health helps make sure our water is safe, as well as applying standards to bottled water. Public health works to keep our air clean by controlling outside pollution as well as indoor pollution in office buildings and public places. Public health is responsible for providing vaccines for infectious diseases like the flu, hepatitis, chickenpox, and the measles. We are always working behind the scenes to actually prevent disease outbreaks like SARS and West Nile virus before they occur. Public health is also responsible for various facets of emergency preparedness in the case of either a natural disaster or a biological or chemical terrorist attack like smallpox.
Now that really scares me.
Well, you'll be glad to know that Massachusetts is implementing emergency preparedness programs throughout the state to protect you. But that's just the beginning. Do you send your kids to summer camp? Public health inspects camps to make sure they're safe. Do you eat out? Public health employs food inspectors to make sure restaurants practice clean and safe food handling. We also work to inform and protect the public on issues like smoking, teen pregnancy, tattoos and body piercing, AIDS, domestic violence, elder health, lead poisoning, and nutrition. So you can see that protecting people is what public health is all about.
Yes, I can see that. I also realize there's a lot more I'd like to know about.
Well, we'd like you to know more because information enables you to protect yourself. Each of us has a responsibility to be informed about public health issues and practice good public health procedures in order to protect our families, neighbors, and our communities. Sometimes it is as simple as washing your hands more often during flu season to help cut down on transmission of the flu virus. We want you to be informed, so we will provide websites and phone numbers as we go and list them all at the end of this program. But in the meantime, what areas would you like to know more about now?
Food and water, protecting children, and definitely preparing for an emergency.
Okay, let's do it. Public health infrastructure varies from state to state. Here in Massachusetts, at the state level, we have the Department of Public Health. The state is also divided into 6 regions in addition to Boston. And importantly, we have a local board or Department of Health for every town in Massachusetts. This means that wherever you live, there are local public health officials assigned to address specific issues and occurrences right in your area. To find your local Board of Health, you can call the State Department of Public Health at 617-624-6000. Or if you have access to the Internet, you can visit the website for the Massachusetts Health Officers Association at www.mhoa.com, which lists contact information for the local boards of health. You can also find a lot of important information on the state's website, www.state.ma.us/DPH. On the western edge of Massachusetts, in the valley of the Housatonic River, is the town of Lee. Lee is a small town with a population of only about 6,000 people, but because it is situated in the Berkshire Mountains, thousands of tourists flock to the area every year. There are many food establishments and recreational facilities that keep the local Board of Public Health very busy. Peter Koloje is a local public health official. He is the director of the Tri-Town Health Department and a registered sanitarian.
The typical responsibilities of a Board of Health include oversight of water supplies, the siting and permitting of newly constructed private water supplies, food service inspections. There are many types of food establishments. There are many pools and spas, particularly in our region. That's a large tourist area. So the routine sampling and testing of the pools and hot tubs is very important to ensure that the people using those facilities are safe. This is a site that our department was called in on. As you can see, around the perimeter of this well, there's an opportunity for surface runoff, stormwater to encroach, and whatever's in that stormwater is going to get into the well. So potentially there could be contamination from oil, salt, fecal matter from animals. Anything in that stormwater could potentially get into this dug well. So the new site is located close to the house, up gradient, away from any stormwater runoff. And being a drilled well, again, it affords the better protection from outside sources of contamination. Right now we're approaching one of the spas in our region. It's called Cranwell Resort and Spa. Within this facility they have a restaurant, they have pools and hot tubs. This is one of the food establishments at Cranwell called Sloan's Tavern. Typically what we do when we first get into establishment is you observe, see what's going on, look at and observe how people are handling food, and if there are any opportunity within that process where contamination could occur and resulting in illness to the public. Another part of the inspection will be ensuring that any foods being held are at the proper temperatures. Hot and cold foods, you want to stay within a range of 45 and 140. Again, the significance that we're looking for in terms of maintaining those temperatures within that range is to ensure there's not an opportunity for bacteria to grow to the point where it could cause illness. This is one of the facilities that we would sample during our 2-week scheduling. So while I'm here, I'll take a sample. The sample bottle, I'll date, the time, where it is, and where the facility is located. Okay, so here is the sample that was collected from the Cranwell Spa, from the pool. And we're going to conduct analysis for fecal coliform that we typically do every 2 weeks from the pools and spas in the region. There can be many diseases associated with contaminated pool water. It doesn't take much to cause a disruption in a pool because there are many environmental factors that can end up causing a pool water to be contaminated. And without having some sort of measuring tool that we have, the general public really doesn't know that those facilities they access and use are in fact safe and not creating a public health hazard.
Public health is important to all of us. You know, when we talk about clean air, we're talking about good public health. When we talk about clean water, we're talking about public health. When we're talking about clean food, we're talking about public health. And when public health is doing its work well, then it's invisible.
Public health is fundamentally about protection and prevention. When I have a heart attack, if I have a heart attack, I'm going to want to go see a clinician. I'm going to want to see a cardiologist. I am not going to want to see a public health physician. But before I have that heart attack, I want to make sure that there are programs and services and information and other things that I can access that will help me live in a way that will prevent that event from occurring in the first place. That's what public health is.
Preventative public health information is often conveyed by a public health nurse, whose major responsibilities include educating the community regarding issues that concern them, like diabetes, cancers, and stroke prevention. Public health nurses coordinate clinics and give immunizations to those at risk for hepatitis A and B, tetanus and flu, as well as meningitis for first-year college students, to mention a few. Public health nurses consult with medical offices, nursing homes, daycare centers, and school nurses regarding the prevention and control of communicable diseases. To find your local public health nurse, visit the website of the Massachusetts Association of Public Health Nurses at www.maphn.org. Located in southeastern Massachusetts, Plymouth is the site of the Mayflower Landing and the first permanent European settlement in New England. In 1620, infectious diseases such as cholera, smallpox, measles, and typhus were a serious threat, especially to Native Americans who had little or no immunity to diseases brought by Europeans. Today, we have significantly reduced the threat of infectious disease, primarily because of public health advancements, including immunization, clean water supply, modern sewage treatment, and vigilant surveillance of health trends by public health professionals.
Show me with your fingers which way the E is going. Good job. And this one?
Public health nurses and school nurses are often some of the first healthcare professionals to see new health trends. In some towns, public school nurses are subsidized by the State Department of Public Health. This is important to ensure that all children have access to a school nurse and to provide valuable health trend information to their local health department.
Okay, Joe.
This is Indian Brook Elementary School in Plymouth, which serves about 740 children from kindergarten through 4th grade. Barbara Poole is the school nurse.
We are used a lot as a clinic. The parents will send their children in, go see the school nurse. So first thing in the morning, sometimes I have 5, 6 children standing out there with swollen joints, cuts, difficulty breathing.
In addition to minor cuts and scrapes, school nurses now see children with illnesses like cystic fibrosis, asthma, and diabetes. 5 or 10 years ago, these children would have been sent to specialized settings or kept at home.
And what are you having for lunch today? Chicken nuggets?
The ability of the school nurse to manage their medical needs enables these children to attend public school.
Do the blood glucose before you go to gym.
Okay.
Okay?
The nurses very much provide the comfort that your mother would, but also with a keen eye. We have the children for 6 hours a day, so we see them in most of their waking hours. Our little ones are definitely on the front line of infectious diseases, particularly the elementary population. You're looking at more immature immune systems, so when they start to have difficulty, that's when our flags go up and we begin to look more closely. Is it a classroom? Is it a neighborhood? Is it a community?
One of the fundamental tools of public health is surveillance. That is, the documentation of health events as they occur. And I think school nurses are in a wonderful position because they sit at the front line to see some of the adverse effects associated with health behavior in our kids.
The data that the nurses collect in real time as students come into the health office, all of that information now comes into a centralized computer. That information on a monthly basis is tied into the state. The state then takes that data and does a comparative analysis across all the enhanced school health districts that are submitting the same data, and they'll be able to look at trends. The trends that the nurses see in the schools play a huge role in helping the boards of health and the state determine what's going on in the community. The endocrinologists and the American Diabetes Association, Juvenile Research Diabetes, they all use our information to see what's going on.
This is the crucial link that exists between public health prevention, the prevention of diabetes now, the prevention of children being addicted to tobacco now, and the benefits 20 and 30 years down the road. We have to take resources today, which may be scarce, and invest them in the future.
All righty, see you later.
Everyone understands the importance of protecting children, but public health also protects and advocates for the entire community. In Massachusetts, there are many instances where public health organizations provide vital health education and testing for the most underserved residents. One such program in Boston is called the Family Van.
Because your doctor ever said you had high cholesterol.
The Family Van works with the existing medical care structure to detect illness early, to promote better personal health management, and, when necessary, to refer people to additional medical care. This is a good example of how public health fulfills the responsibility of making sure all residents of the Commonwealth have access to services, information, and help.
The Family Van is a mobile health services unit that provides health education, screening, and counseling to Boston's most vulnerable populations. Our clients are 98% people of color, and for approximately a third of them, English is a second language. Over half of them have insufficient or no health insurance at all. Some of the services we provide include pregnancy testing, HIV/AIDS testing and counseling, cancer screening and management, nutritional counseling, glaucoma screening, body mass index or BMI for obesity reduction. Our services and testing range the lifespan. We are able to monitor patients before they get into crisis. This in turn will prevent frequent emergency room visits that are unnecessary and costly to the average taxpayer. And in that sense, we are a very cost-effective service that enhances primary care.
So far, we've seen some good examples of how public health protects our food and water, our children in school, and all of us from infectious disease. But what about new threats to the public? Threats that in the past we couldn't imagine we would be exposed to. Public health officials at local and state levels are working to protect all the citizens of the Commonwealth from these new threats.
To be prepared for an emergency, the most important thing is to have a strong public health department. In light of what occurred on September 11th, as well as the directives that we've received from both the federal government and the state government, we have adapted our approach to emergency preparedness by now incorporating what we call an all-hazards approach. For example, chemical emergencies, radiological emergencies, infectious diseases, naturally occurring emergencies such as an outbreak of SARS, or for that matter, a particularly bad season of West Nile virus. So an all-hazards approach allows us the flexibility to respond to a variety of different kinds of emergencies with the appropriate response.
The Department of Homeland Security has directed states to develop plans to deal with emergencies. In Massachusetts, public health officials in all towns are involved in planning to better prepare for all hazard emergencies. In most towns, the risk of an occurrence is very low. However, Boston, as the largest city in New England, is a busy international coastal port where planes and ships arrive daily from all over the world. Boston is one place where emergency preparedness must be state-of-the-art.
We've significantly strengthened the connections between local public health and people who are involved in public safety activities, fire and police, for example, as well as others that are involved in health care. We receive on a daily basis from the emergency rooms in Boston information about the number of patients that are being seen every day in the emergency room. We get that information back in the Health Commission, and then we analyze it to see whether or not the volume is above what we would anticipate for that kind of a day and that kind of season. And if we see any kind of variation that seems unusual, we talk directly with the hospitals involved and try to understand more about what was actually occurring in the emergency room. Were they seeing people with gastrointestinal symptoms or with rashes? Is there anything that would make us suspicious of those symptoms and want to gather more information? In addition to working more closely with hospitals, we've also strengthened our relationship with emergency medical services, or EMS.
Emergency medical services in the city of Boston is part of the city's Public Health Commission. We really look at ourselves at the intersection of public health and public safety. Public safety is what most people refer to as the police officer, the firefighter, the EMT, the paramedic, that when you need something, they come right away. Public health is usually looking at incidents over a period of time, there for your health, there to make sure prevention efforts, and there to look at an overall health picture. What we found is that public health and public safety actually have to work together. And an outgrowth of that has been specifically the Duvalier Institute of Emergency Preparedness. All the hospitals in Boston, all the medical community in Boston, the health centers, public health, EMS, all receiving the same training on the same equipment in the event of a major incident throughout the city, whether it be a chemical, biological, radiological, nuclear, or explosive incident. At the hazardous material for healthcare course is an opportunity for them to actually go into a hazardous material suit. So they get used to operating in this environment when they may have to take care of large numbers of patients who are contaminated. What this training is able to do is to teach them the correct way to do that to keep themselves and to keep their hospital and facility safe. There's a saying in public safety that you don't want to be meeting people for the first time at the scene of an emergency or at the scene of an incident. Now people are meeting not at the scene of an incident, but at the scene of trainings, at the time of exercises. And that's the way that we want to prepare and be prepared in case an incident were to happen.
There's been particular concern about the potential harm that could result from exposure to a biological substance, something like anthrax or smallpox. If we identify a potential harmful substance, we have a mechanism in place to quickly transport that substance to either the state laboratory or a federal laboratory for quick analysis.
The Massachusetts State Laboratory Institute has the ability to perform rapid and confirmatory tests for biological agents. When a specimen is delivered to the laboratory, initially we check to make sure that the package is packaged properly, that the paperwork is filled out. The specimen is then brought up to our bioterrorism laboratory, and we open it up underneath the biosafety cabinet. Initially we do what we call a gross exam, where we're looking at the envelope. We're looking to see, is there a threat present? Is there a powder present? If we try to kind of look at the powder and see if we can figure out what the powder is, sometimes we can. Then we take a small sample of the powder and we mix it with sterile water. We apply it to a blood agar plate and we check at 24 hours and 48 hours to see if any bacteria grow. We can also put some of that suspension on a microscope slide, and we're looking for spores, for example, if it were anthrax.
Across the state, all cities and towns are working to develop emergency preparedness plans. For example, a community committee might bring together a public health nurse with local emergency management agencies to put in operation mass immunization clinics, shelter care, and telephone call-in lines. Each community decides what is appropriate for its population and location.
Every town has unique needs that they need to think about for emergency preparedness. For example, in Plymouth, our proximity to the Pilgrim nuclear power plant poses its own special needs. We're within the 10-mile evacuation protection zone. We would distribute potassium iodide tablets with parental consent upon direction of the Department of Public Health in the event of a nuclear emergency.
Most Berkshire communities, like Lee, are small. We don't have a lot of resources. That's why it is important that we have, for past many years, been working collectively with other large communities and these local emergency planning committees.
We bring together now 27 communities and towns and cities that come together on a regular basis to look at how prepared we are, around training, how prepared we are around drills, as well as plans for our individual communities.
It's critically important in terms of the emergency preparedness work for us to be communicating continually and accurately with the general public. We've developed educational materials, pamphlets and brochures, and we've translated those into a wide variety of different languages. We've also developed websites that provide the public with information that can be updated immediately and provide some degree of interactive communication.
One thing that we've learned post 9/11, there is no one city or town, there's no one state that can do it alone. We're all in this together, we all have to work through this together, and we're all coordinating our efforts.
He was taking the balloon out and putting it back again, as happy as could be.
So, do you think you understand how public health works to ensure the safety and well-being of your family?
I sure do. I now know that there is a local board of health right here in my town, and I know how to contact them. Public health protects my child at school, protects our food and water, and public health is taking steps to protect us in the event of an emergency. But before you go, you did say you'd give me the rest of the contact information.
Okay, let's do that right now. Massachusetts is lucky to have an umbrella public health organization, the Massachusetts Public Health Association.
The Massachusetts Public Health Association is the state's leading public health advocacy organization. We're a membership group, and we would love to have you join. It's important for people to get involved in their local communities and at the state level to make sure we have a strong public health system in Massachusetts. To find out more information about our organization or about public health, please visit our website or give us a call.